A fracture is a medical condition in which there is a break in the bone. It can be the result of a high force impact or stress that can weaken the bones. In this video, we will be talking about fractures. Not just basic fractures, but the types, how severe they can be, and of course treatment and prevention. We can't talk about fractures without first talking about bones. The skeletal system is made up of 206 bones, which help maintain blood cell production, support, storage, protection, and movement. There are many types of fractures, however, we will only be discussing 8. A green stick fracture is an incomplete fracture in which the bone is bent. A transverse fracture is a fracture at right angle to the bone's axis. An oblique fracture is when the break has a curved pattern. A comminuted fracture is when the bone is splintered or crushed. An impacted fracture is when one broken bone is wedged into the other broken end. A compression is when the bone collapses, especially short bones. And a spiral fracture occurs when the force is applied along the axis of the bone. An epiphyseal fracture is when bone separates from the main body of the bone by a layer of cartilage. The signs and symptoms of a broken bone include swelling or bruising over a bone, deformity of an arm or leg, or loss of function in the injured area. There are a few ways to distinguish the severity of a bone fracture. The two most common being a closed or simple fracture, where the bone breaks cleanly but does not penetrate. The second being an open or compound fracture, where the bone penetrates the skin. It not only damages the bone, but it will break or protrude out of the skin. There are several steps to treating fractures, but the first and most important part is identifying the fracture. The most common way to identify a fracture is by X-ray. However, a wrist fracture cannot be shown in an X-ray, meaning an alternate method such as a CT scan, MRI, or bone scan would be used. After the fracture diagnostic, you may need more tests, such as the ones mentioned before, to make sure that the tissue around the bone is not damaged. However, in the case of a skull fracture, doctors will go directly to a CT scan to diagnose the fracture or injury and to check for bleeding around the brain. As anyone should know, a fracture requires emergency treatment unless it's minor. If the person is in shock, faints, or has shallow breathing, then emergency help is definitely needed. Fractured bones must be set in their proper place and held there in order to heal properly. Setting a bone is called reduction, and repositioning a bone without surgery is called close reduction. After setting, most fractures are immobilized with a cast, splint, or occasionally traction to reduce pain and help healing. A cast holds a broken bone in place as it heals. Casts also help prevent or decrease muscle contractions and are effective at providing immobilization, especially after surgery. Casts are made of 2 different kinds of casting materials, either from plaster, which is white in color, or fiberglass, which comes in a variety of colors. Cotton and other synthetic materials are used to line the inside of the cast to make it soft and to provide padding around bony areas. A couple examples of casting are unilateral hip spica cast, which is applied from the chest to the foot on one leg and is used in thigh fractures and also used to hold the hip or thigh muscles and tendons in place after surgery to allow healing. Another example is a shoulder spica cast, where it is applied around the trunk of the body to the shoulder, arm, and hand, and is used in shoulder dislocations or after surgery on the shoulder area. Traction is the use of a pulling force to treat muscle and skeleton disorders. It is usually applied to arms, legs, the neck, and backbone, and it is used to treat fractures, dislocations, and long-duration muscle spasms. Traction serves several purposes. It aligns the end of a fracture by pulling the limb into a straight position. It ends muscle spasms. It relieves pain, and it takes the pressure off the bone and ends by relaxing the muscle. A tibial traction is a pin surgically placed in the lower leg. The pin is attached to the stirrup and weighted. In cervical traction, an incision is made into the head, holes are drilled into the skull, and a halo or tongs are applied. Weights are added to pull the spine into place.
In 1931, Lewis Pickering and Rothschild came up with sensory of pressure and discovered changes during and after compression of arms of normal subjects. It is a form of tingling occurring after the release of compression. There are 3 sensations that can be aroused: tingling, velvety numbness, and release prickling.
A new form of casting, called 3D printing, was created by Jake Ivell, who was all too familiar with this problem. Evil figured that there had to be a better solution to the plaster casting, so he created the Cortex cast. His new take on the plaster cast is a 3D printed brace that follows the contours of the arm. Even though it is still just a concept, his Cortex will be an injury-localized exoskeleton that is lightweight, washable, ventilated, and recyclable. Evil notes that the Cortex cast is still very much in the development process. He is currently working to nail down the optimal material for the cast and refine the scanning process. His next steps will be working in a hospital to fully test the prototype and finding a manufacturer to help make the Cortex cast a reality. There are 3 steps to creating a 3D printing cast. First, the limb is x-rayed in order to identify the break and its exact position. Next, there's 3D scan in order to define the exact dimensions of the limb. Next is a 3D print itself. Dimensions and data are fed into the computer. A cast is generated with optimal support for vulnerable areas and to exact the limb size for a snug fit. In order to prevent fractures, one should consume sufficient amounts of vitamin D and calcium, avoid smoking and excessive alcohol because it slows reflexes and alters balance, exercise at least 3 times a week, wear a seatbelt when in a vehicle to prevent motor-related injuries, wear protective gear when participating in contact sports, and gate stairways and keep windows closed if small children are in the house because it is easy for them to get hurt. In conclusion, a fracture is a break in the bone caused by a high impact or force, thus weakening bones and causing different medical conditions. There are many different types of fractures. A few symptoms could be swelling and bruising, deformities, loss of function, etc. An open fracture is when the bone goes through the skin, while a closed fracture is a clean and internal. The type of fracture can be determined by X-ray, and there are many methods of treatment, traction and casting being 2, and there are many ways, both simple and sensible, to prevent fractures.
What does the fox say? What the fox say? What the fox say? Happy, happy, happy ho. Happy, happy, happy ho. Happy, happy, happy ho. What the fox say?